Important notice, new plan changes. Medicare annual notice of change letter is going out. You should be receiving it about the third week of September, is what I have read. And this pertains to U.S. citizens or anybody under the United States of America Medicare, Social Security Medicare system. And you should get a letter. Um, you may not get that letter if you've given an overseas address. It might come late, so be aware of that and contact your provider. We'll get into some of the details here in a bit, but basically, every year Medicare sends out an annual letter of change, notice of change. ANOC is the acronym, and there is a usually you should receive it about mid-September, last maybe the third or fourth week, and has to do with your current plan changes for 2026 or whatever year we're going into. Um, just in case you're watching this in 2026 or 2027. Um, some plans may be ending, is what I've read. The cost of some plans may be changing. We'll get into some of the details. You have the basic Medicare Plan A, which is hospitalization. Plan B, which is more the doctor side, the medical side, and I'll get into more details of that later in the deal. But there are options. There are options. You can go with the basic plan like I do, Part A and Part B. But once a year, you can change. You can go into an Advantage plan or a Medicare, what they call Medicare Medigap plan. Take care of because Medicare does not cover everything on both the hospital and the medical side. There's deductibles and there's approved costs and procedures, and there are non-approved costs and procedures. Basically, there's an open enrollment period from an annual enrollment period from October 15 to December 7th. And you shouldn't wait till December to do this because it takes time for all this to take place. So October 15th, you've got until now, September to October 15th, to look at your plan and your other options, and you have until December 7th to switch your plan if you want to. From the basic, you have to carry Part A. Part B is optional. Right now, the cost is 185 US dollars a month, and that covers the medical side up to like 80% of their approved expenses. You can also go with a Medigap plan with a private company, or you can go with a what's called a Medicare Advantage plan, which is private companies, and they've got, I think, either HMO type plans where you have to work within a network of hospitals and doctors approved by them, or a PPO plan where you have a little more flexibility, still done by private companies versus the government system. So Medicare supplements generally are standardized by the government, and the Medicare Advantage plans are private, but they have to provide Part A and Part B, but they often provide Part D, which is prescription drug as well, and you can opt in and out of that. The Part D, the prescription drug, very inexpensive. I think it's between 35 to 45 US cents, not dollars, cents per month that you can sign up with. And I'll get into more of the details here. But anyway, let's go over to that Medicare site. So jumping over to the official Medicare.gov, the U.S. government agency, and plan annual notice of change, ANOC is the acronym. And what is it? If you're in a Medicare plan, your plan will send you a plan annual notice of change, ANOC, each fall. And my understanding is it should arrive about the third week of September. Now, if you have a out of country address or in some remote place that you have trouble getting mail, it may take a little bit longer than that. When should you get it? September, and what I've read, usually it's about the third week of September. Who sends it? Your plan sends it. What should I do if I get this notice? Review any changes to decide whether the plan will continue to meet your needs in the next year. If you don't get this important document, contact your plan. And jumping over to what are the plans? Explore your Medicare coverage options. Get more coverage once you have Part A or Part B, and we'll go over some of those details for some of you who either aren't aware of that or you have forgotten. Save time by logging in. I didn't log in. You can continue without logging in. Enter your zip code, Arizona, USA zip code, and you can get information on Medicare Advantage plan, Part C, Medicare Drug Plan, Part D, Medigap policy. What type of plan should I choose? And I will. And jumping over to Social Security, which Medicare is under, I believe parts of Medicare. There are different parts of Medicare to match, and this for if you haven't signed up yet or you've been signed up but you really haven't paid much attention. You'll sign up for Medicare through Social Security, and you can sign up for Parts A and B or Part A only. And let's get into details. Part A is hospital insurance. Part A helps pay for inpatient care at hospitals, skilled nursing facilities, hospice. Also covers some outpatient home health care. Part A is free if you worked and paid Medicare taxes for at least 10 years. You may also be eligible because of your current or former spouse's work. Part B, medical insurance. Basically, the doctors covers services from doctors and other health care providers, outpatient care, home health care, durable medical equipment, some preventative services. Most people pay a monthly premium for Part B, and yeah, the premium for most of us now this year, 2025, is $185 a month, and you can opt out of that once a year, and we'll talk more about sign in, sign out periods. Exact premium depends upon your income level. Review what you might pay for Medicare. Part C and D. Private companies run Part C and D. The federal government approves each plan. Costs and coverages vary by provider. There's some latitude there. Part C, Medicare Advantage, is run by private companies. It's an alternative to Parts A and B that bundles several coverage types, including Parts A, B, and usually D. May also include vision, hearing, dental insurance. And yeah, Medicare Advantage, and I'll get a little more into the companies here in a bit, but they often charge the same, but they might charge a little bit more, and they often cover everything that Medicare Part A and B does, the government side, plus some other perks, some other advantages. And they can change those plans. They can change the costs and the benefits each year, and we'll talk a little more about that. Part D is prescription drug coverage, helps cover, and you must sign up for Part A or Part B before enrolling in Part D. And yeah, very inexpensive. My understanding is that it costs about somewhere between 35 to 45 cents, US cents, per month. So not very much. And if you don't sign up for that initially, if like 2-3 years from now you decide to sign up for Part D prescription drug coverage, there is a penalty for waiting of about 1% per month. So 1% of, let's just say, 40 cents per month for how many months you didn't sign up for it. There's also a penalty if you don't sign up for Part B. And I know a vlogger that lived here in the Philippines for many, many years. He did not sign up for Part B, and that goes up a little bit every year, 185. So he didn't sign up for, I don't know, maybe 10 years, something like that. And then when he moved back to California, Southern California, he signed up and he was penalized a certain amount for each year that he didn't pay for Part B. So keep that in mind. And you can sign up for a lot of this stuff online, I believe. Yeah, right here. Sign up for Medicare. You used to have to go to a Social Security office to sign up for that, I believe. And I think I did that many, many, many years ago. And back over to Medicare.gov. And let me just say a few things here. The current plan changes. The Medicare, the annual notification of change letter, you've got a sign-up period. Like I said, you should receive it in September, and the annual enrollment period is October 15th through December 7th. So you have to make any changes between October 15th and December 7th, and don't procrastinate. Do it at least before Thanksgiving. By Thanksgiving, take some time. A year or so ago, a year and a half ago, I filled out a form. I sent it to the U.S. Embassy in Manila, and by registered mail, and they received it. And I sent them a couple of emails because I hadn't got any response, and it didn't go into effect when I asked it to go into effect, but eventually, like 1 or 2 months later, it actually did. And so they were processing it, but I never got any responses to my emails. I'm sure they're very, very busy. Your new plan changes, if you make some plans, will take effect January 1st. You've got the HMO and the PPO plans. HMO is in network. PPO has a little more flexibility there. Medicare supplements, on the other hand, are pretty standardized, and they have to basically cover. The government standardizes what they have to pay out, basically. And let's see what else here. Medicare Advantage plan. If your Medicare Advantage plan ends, and I've got something here written down, I'm not sure quite how it works, but it says that you can make a plan change between December 31st and March 31st. I'm not sure. That's their open enrollment period for Medical Advantage plans. I've written that down. I read it someplace. But if you sign up in January, for instance, if you're on one plan and your plan stops at the end of December 31st, and you waited till January to sign up for a new plan, means your new plan wouldn't start until February 1st, which means you'd go a month basically without coverage. And if you've got 20 years in the military, my understanding is that your Plan B of Medicare is free if you've got TRICARE, and I'm not sure all the details there, but the military pays for your free Part B in that instance. And then a lot of the military, they do not sign up for Plan D, the prescription drug, because their VA, Veterans Administration, pays for their prescription drugs. But in such a time that you might not live near a VA hospital or clinic, some people will pay for that extra. Part D is what I have read. Not sure about that. Anyway, let's get into a few more details here, just in case you forgot. Inpatient hospital care, this is Part A. Hospital insurance usually covers inpatient care if you meet these conditions. You're, you've gone to a hospital as an inpatient after an official doctor's order, which says you need inpatient hospital care to treat your illness or injury, and the hospital accepts Medicare. There again, I know a number of hospitals that they've got too many Medicare patients and they stopped accepting Medicare. And this was decades ago, I think. So, your cost in original Medicare, and this is Part A as of 2025, days 1 to 60. Zero after you meet your Part A deductible, $1,676. So there is a deductible. Days 61 to 90 in the hospital, $419 a day. So it can still get quite expensive. Days 91 and beyond, hopefully you're not there over 3 months, $838 each day for each lifetime reserve day, up to a maximum 60 reserve days over your lifetime. Each day after you use all your lifetime reserve days, you pay all costs. So Part A only pays for up to 190 days of inpatient mental health care in a freestanding psychiatric hospital during your lifetime. If you also have Part B, it generally covers 80% of the Medicare approved amount for doctor services you get while you're in the hospital. There's another thing, Medicare approved amount. Medicare might say this procedure we only allow 1,000, but the hospital or the doctor charges 1,500. So Part B would pay 80% of the 1,000 and leaving you to pay the other 20% plus the extra $500. And what's covered? Part A, Medicare coverage, inpatient hospital services, semi-private room, meals, general nursing, drugs including methadone to treat an opiate use disorder, other hospital services and supplies as part of your inpatient treatment. Medicare does not cover private duty nursing, a private room unless medically necessary, a television or phone in your room, if there's a separate charge for these items, personal care items like razors or slipper socks. Inpatient hospital care includes care you get in acute care hospitals, critical access hospitals, inpatient rehab facilities, inpatient psychiatric facilities, long-term care hospitals. So yeah, I sold Medicare supplements back in the 1970s, I think late 1970s, up in Minnesota, and yeah, this has all changed. All these amounts have changed over the years, and it seemed like it was a little simpler back then, but was pretty much laid out the same way. Your costs over time change in the hospital, but hopefully you're not in the hospital 2 months or even 1 month. And then what Part B covers, explore Part B. Medical insurance, there again, $185 a month this year, 2025. It basically is for doctor services, medically necessary services, and you don't have to sign up for this. Necessary services or supplies that meet accepted standards of medical practice to diagnose, treat your medical condition. Preventative services, healthcare to prevent illness like the flu, or detected at an early stage when treatment is likely to work best. You pay nothing for most preventative services if you get the services from a healthcare provider who accepts assignment. Yeah, not all doctors and clinics accept assignments. Part B covers things like ambulance services, clinical research, durable medical equipment, limited outpatient prescription drugs, mental health, substance use disorders, oxygen equipment, and accessories. Yeah, Part D, medical prescription drug plans. You can sign up for a number of different types of plans, and that may change each and every year. There are different types of websites that'll help you find that type of thing. Yeah, Part D, medical prescription drug plans. You can sign up for a number of different types of plans, and that may change each and every year. There are different types of websites that'll help you find that type of thing. And of course, I think most of you know if you're an expat not living in the USA, you are not covered by Medicare 99% of the time. Maybe in a rare occasion you could be. Uh, that's where an Advantage plan, some of the Advantage plans will cover you if you're not out of the country 100% of the time. I've got several friends that they come here for several months, 5 6 months, then they go back to the U.S. For several months, come back here, and so generally they are covered, and they would generally have to pay up front, pay, and then wait for reimbursement. But that might be one advantage if you're not going to be out of the country full time. Over time, those policies can change, just like one of the reasons for the notice to go out. Prices change, policies change, what they cover, what they're uh, each and every little item there. So it's worth checking all that out. Anyway, thanks for coming along. Safe travels, and we'll see you in the next video.